On the first leg of the program this morning, we are talking health, not just any kind of health issues, but majorly we're talking breast cancer. This is Breast Cancer Awareness Month, and we're going to be dwelling on the essence of this Awareness Month. And joining me on the phone line, I have Dr. Bolanle Adegboyega, who is consultant clinical and radiation oncologist, and also head of the brachytherapy unit for the NSIA Youth Cancer Center. Dr. Adegboyega, it's nice to have you. Good morning.
Good morning, Mr. Victor. Nice to be here too.
Great.
Thank you.
I'm having some background noise where you are. I hope we can manage this at this time. But it's been quite a while since we actually trekked this road of advocacy with the NSIA Youth Cancer Center. So how are things faring with the center?
Yeah, we're fine. Thank you.
So the center is moving on pretty well, right?
Yes. So just as a point of note, the center has just changed in June from NSIA Youth to Medserve Youth Cancer Center. So due to the success of the NSIA project, the federal government has commissioned NSIA to replicate such in another 6 states, in 6 geopolitical zones of the country. So they have a section dedicated to healthcare. So the section is now named Medserve. So that's the name change.
Oh, okay.
So we are now more Medserve Youth Cancer Center.
All right.
So NSIA is the parent body.
Right.
Yeah.
Okay, that sounds pretty good. So let's settle in on the subject of discourse this morning. Breast Cancer Awareness Month. Is there any reason why October is designated as the Breast Cancer Awareness Month?
Oh, well, I never thought of that. So I may have to go and check why October.
Right.
And then there are so many awareness, like every day of the year is dedicated to one thing or the other.
Right.
And so here we are in October for breast cancer.
Okay. So for those who might not know, what is breast cancer?
So breast cancer is a malignant transformation of the breast tissue. So when I say malignant, so swellings generally can either be benign or malignant. Malignant is one that can spread rapidly and then can spread to other tissues from the primary origin. So when the breast tissue has such transformation, it is called breast cancer. But then there are so many other swelling that they can't spread to other tissues,
right,
and they are not as deadly. Those ones are benign breast tumors.
All right. So how common is breast cancer in this part of the world?
Okay, breast cancer is quite common. Actually, it's the commonest cancer in globally in both male. If you put all the cancers in both male and female together, breast cancer is the leading cancer, and it's also the leading leading cause of cancer death. So in Nigeria, like 1 in 8 women would come down with breast cancer in their lifetime.
Wow.
So like in my center, it's about 60% of all the cancer cases you see in a month is breast cancer. So it's actually the commonest. And it's not peculiar to only women. It can also occur in men because men too have breast. So only that if you put 10 cancer patients together, 9 of them will be female and only 1 will be male. So it's far commoner in female, but it does occur in males too.
Wow. Okay, so 1 in 8, that's very, very high, if you ask me. And some will be, so someone would like to know really what causes breast cancer.
Okay, so most times we don't only talk about causes, we talk about predisposing factors. Why? Because at times you might not know what the causes is. But then, so in breast cancer, generally, there are some factors that you can help, there are some you cannot help. Then there's nothing you can do about it. So the ones you can help are stuff like, so let me start with the ones you cannot help.
Okay.
So breast cancer runs in the family. So there are genetic abnormality that can lead to it. There are some genetic, like BRCA genes can run in family and can actually be a cause of breast cancer and other cancers like ovarian cancer, even prostate cancer, pancreas cancer. Those ones run in the family. So in that case, there's nothing you can do about it. So breast cancer is also commoner in some races, like we have it more in blacks like us, and there's even a particular subtype of breast cancer, like triple negative breast cancer. It's commoner in blacks and young females. young women. So in that case, there's really nothing you can do about being a woman or being a black. Then there are some, when you are aging, it's commoner among the age, as you are aging, breast cancer is also commoner among the elderly compared to the younger age group.
Right.
So in such case, there's nothing you can do about that. But then other things like obesity, when you are too fat or you're having a sedentary lifestyle, or there are some hormonal changes that can also cause it. For instance, people that have more exposure to hormone, maybe when they start menstruation earlier than normal, maybe earlier than 13 years, or they stop menstruation later, maybe later than 55 years.
Right.
Those ones have more exposure to hormone, and it can also be a cause of breast cancer.
Right.
So, and then other things like that.
Okay, so what about
diet? Our diets too. Diet high in fat and then low in fruits and vegetables can also predispose to stuff like that. There's some that have had previous radiation to the breast, maybe, or radiation to the chest wall. If somebody was treated for head and neck cancer and a part maybe to the neck, and then later in life they can come down with breast cancer, but those ones are very rare.
Okay, so you talk about age earlier on as well. Is breast cancer age discriminatory? Does it tell you the type of age? I mean, what age it can actually bring its onset?
Okay, so most of our patients are in their middle ages, from like 45 to like 60. That's the commonest age group we have for breast cancer. So in that late middle age to elderly, it's commoner compared to the younger age group.
So it's not.
We do have it in younger age group, like in 25, 30 to do come down, but then the majority are in that age bracket of middle age group to elderly.
All right. So let's talk about physical things that we see. So does the size of the breast determine if the person will come down with cancer?
Okay, no, stuff like that don't happen. But then, so things we will see basically, so that's why it's so painful when we see patients coming down with breast cancer at advanced stage, because breast is outside in the body. Mm-hmm. You see it, you feel it, you touch it. So when there's an abnormality, you should actually pick it early. So the abnormality comes from variation in breast sizes. So you should get used to what your breast look like. Naturally, left breast is bigger than the right for most people. Okay. But then you should know what the disproportion is. So when it's now getting out of the normal proportion that you used to know, it might be a suspicion. So when one breast is far bigger than the other, when there is the nipple is actually supposed to be outside.
Right.
But some do have nipples that are inside, but you are used to that. So but not a recent change. So when the nipple that was formerly outside is now going inside, it might be a pointer. Then any swelling in the breast, and not only in the breast, even in the armpit. So because the breast and the armpit, one of my teachers of blessed memory used to call them first cousins. So some people may not even have anything in the breast. It may start in the armpit because the lymph node that drains the breast are in the armpit majorly. So a swelling in the breast or in the armpit can also be a pointer. A change in the color. The nipple around the areola is darker. Right. Then when it's now becoming reddish, or somewhere that was not dark before, it's now becoming dark. Then a discharge from the breast. If you are not breastfeeding, you are now having whitish or milkish or bloody discharge from the breast.
Right.
It may be a pointer. Or when there's now a wound on the breast or around the nipple. So those are the pointers to there's something going on in the breast, and you should check it out.
All right. So you just told us the symptoms and the signs and what you should watch out for, right? Okay. Yes. So, but as a consultant like you, is there a way you can just look at the woman and you say, look, from by look at this breast, is likely that you're coming down with cancer? Is there a way that can be?
Okay. So, I like that question. Thank you for that question. So let me say, before answering that question, is to tell people that anytime you have a cause to do any surgery and something is being removed from your body, insist that it is taken to the laboratory for histology to check what it is under the microscope. Okay. So because of that, there is no way you can look at a breast and say this is breast cancer. Fine, you might say it is likely. Why? Because most of our patients comes down with advanced stage. So, for instance, by the time it now becomes frank ulcer, there's an ulcer, there's a wound on the breast, or the breast is now looking like orange, like the back of the orange that has holes around. Those ones are almost always breast cancer. But in the early stage, just a swelling in the breast, you cannot say that this is breast cancer. The final way to make a diagnosis is when a sample is removed and then usually with a needle, just a little, take a sample, send it to the lab. That is when you can confirm whether it is breast cancer or not.
Right.
But then, because a patient comes in late, you can at times say that this is most likely breast cancer.
All right, then Lagos Traffic Radio 96.1 FM flash update coming in from the control room. There is an ongoing situation between the transport union members at Body Thomas inwards doing. All right, those of you within the Surulere axis, some kind of mishap there ongoing between transport union members at Body Thomas inwards doing. But I understand police officers on ground trying to manage the situation. So if you want to avoid that corridor, that would be pretty good. All right then. All right, Dr. Adegboyega, even though you've been able to break it down for us, do people survive cancer, breast cancer?
Very well. We have lots and lots of survivors. So that I'm actually happy to say that to people that breast cancer or cancer generally is not a death sentence. The key is early presentation, early detection saves life. So we have lots of survivors, 20 years survival, 30 years survival, even those that have bilateral breast cancer and they are still survival, provided they are coming in early. So we have lots of survivors here.
Okay. So at what point do we now say this is definitely going out of hand, and at what point do we get people like you to come into the scene to help salvage the situation?
Okay, so thank you for that question. So I would say that with all humility, is not every doctor can treat cancer, and not every doctor should treat cancer. Why? Because if a patient comes in early and you're able to see an oncologist early, the approach is different, the things I look out for is different, and then the fear of mastectomy, that is what keeps people away, running away. I'm happy to tell you that not all patients need mastectomy. If you come in early, I can even tell you that you don't have to remove that breast, because there are lots and lots of things to do. But then my approach, I will run out to do surgery. There are so many steps we do and stuff the way we go about it, such that we can even salvage the breast, and then the fear of mastectomy that is making people run away from the treatment can actually be corrected. And even there are other people, is a multidisciplinary team approach, not a single doctor treats cancer. So we have the oncologist there, we have the surgeon, we even have plastic surgeon, we do oncoplasty now, so that we can reconstruct another breast. So we can do the surgery and just remove part of the breast that is affected. So it's not just any doctor that can treat breast. So from the initial diagnosis, an oncologist should be on board. Okay. Even a radiologist, a pathologist. So it's a multidisciplinary team approach, and we're getting good results with that.
All right. Lagos Traffic Radio 96.1 FM 08099120777. Message here says, what are some early signs a woman should never ignore? Esther from Ikeja. Esther, thank you. I think a doctor has spoken about that earlier on, but Dr. Adegboyega, you want to just reiterate it?
Okay, yes, I'll do that. So for women, generally, I usually tell people that familiarize with your breast. Know what your breast looks like in the size, know the color, know how the nipple looks like, then be able to touch it and be able to detect when there's a swelling. Quite a number of patients will come and say that I was having my bath, or I just touched it and I noticed a swelling. So it could be a change in color, a change in size, a change in the skin, and then maybe ulceration, but that is far, and then a lump, like I said, a swelling in the breast or in the armpit. Those are early warning signs that you should actually go and check.
This one says, Ma, at what age should women start checking for lumps or doing screenings? Nkechi is sending this one in.
Okay, so usually from 40 years and above, you want to start screening, but to check for lumps. So there's like I said, there are benign breast tumor that is even commoner in the adolescents to the young women in the maybe late teens or to 25 or thereabouts. So they may also come down with breast swelling, which is usually fibroadenoma. But then even in that case, they should still do the test and be sure that that is what it is. But for the screening, you want to start from 40 or 45 thereabouts. From 40, generally, you should start. There's a place of breast ultrasound and there's a place of mammogram. But if you have family history, then in that case, you have to start a bit earlier and do it more regularly. because it runs on the family. So in that case, the risk is higher. So from 40 and above, women should actually start.
All right.
But it can be earlier because there's a place of just self-breast examination, not even the diagnostic one.
All right. Then this one says, good morning, ma. I want you to please debunk some myths. Is it true that using deodorants or wearing tight bras can cause breast cancer? Mrs. I'm trying to get his name. Okay, Mrs. Oyenuga. Yeah, okay. Thank you so much, Mr. Oyenuga. Doctor?
Okay, yeah, thank you. So there have been lots of studies about deodorant and then breast cancer, but it's really nothing strong associating them. So it doesn't really cause it. Then using a breast tight bra.
Yes.
I think even you yourself, you say tight. So even if you think of the discomfort, you don't really want to do that. But there is no direct association or link between wearing tight bra and breast cancer.
Okay. So as we gradually wind to the end, Doctor, this morning, are there some habits that women are into that could expose them?
Okay, so I really can't tell, but only that the new things that are coming up, maybe issue with the breast reduction or other
breast enlargement.
Enlargement and stuff like that.
Right.
So most of them are like, I don't know, maybe it's hormones being injected later in life, it might actually cause that. But then maybe I would say that we might not be there yet, but there may just be some even waiting in the nearest future.
Okay.
But then I know there might be other means of doing it. Maybe it doesn't involve hormone. The one thing is that we may not have enough data to say that categorically yet, especially maybe not in Nigeria. But then, as much as possible, let's keep as natural as possible.
Right.
You never can say what is not happening now might just happen in the next couple of years.
So how can women take care of their breasts so that they can prevent breast cancer?
Okay, so for women, I would say that familiarize with your breast. You are the best person that can detect it first. And that is about doing regular self-breast examination. So for those that are still menstruating, like 10 days after your menstrual cycle is the best time to examine your breast. Check your breast, check your armpit, and do that as regularly as possible. If you have entered menopause, pick a date in the month that you do self-breast examination. So if your birthday is on the 9th of October, every 9th of the month, please try and do your self-breast examination. Once a year, do a clinical breast examination. That's when you get a medical person, maybe a doctor, a nurse, to examine for you. There are things you might not be able to pick, they might be able to pick. Then when you are 40 years and above, at least once a year, once in 2 years, do a mammogram or breast ultrasound. So let's check. Early detection saves life, and there are survivors.
What about breastfeeding? Does breastfeeding help reduce the incidence of cancer?
Yes, a lot. Yes, because when you are breastfeeding, your hormones are down. And so, because we have said that hormonal exposure also increases the risk. So those that breastfeed their children for longer, it actually is a protective measure. So breastfeeding is well encouraged.
And the very last question I'm going to ask you now. So performance in the other room, can it help reduce breast cancer?
Well, funny enough, in a way, it can help. Might not be directly associated. But I once had a patient, it was a man coming down with stage 4 metastatic breast cancer. And one thing the man said was that if only the wife, because he was a widower, he said if only the wife were to be alive, he would have detected it. Why? Because the woman would have touched his breast and have detected that there's a swelling there. So I'm sure it's vice versa. So performance in the other room allowed the man to be able to touch the breast and be able to detect it. So among the benefits, so other room also helps.
All right, then.
Thank you.
Okay then, Dr. Adegboyega, it's always a thing of joy having you join us on the program. Thank you so much for linking up with us this morning.
Thank you.
Okay.
Yeah, have a nice day. Yeah. Bye.
Okay then, so I have been speaking with a professional to the core as we reflect on the essence of the Breast Cancer Awareness Month. And I've been speaking with Dr. Adegboyega Bolanle. Of course, she is a prominent consultant talking about a clinical and radiation oncologist, and of course also the head of brachytherapy for the Medserve Youth Cancer Center. A brief break. When we return, we'll do our birthdays before we switch to the second segment of the program.